Since I was a kid, I was intrigued. I was in some way fascinated, first of all, how the body works. Just to know that we can breathe, we can run, our body can heal naturally. When I was a kid, it was how we can do that. And now, of course, when I was growing up, now studying medicine, I realized that it's really fascinating. So if we had a chance to provide what our body needs to heal naturally and knowing the different situations, the different disease, for me, I really like it. I've tried to find out how to fix it, how to heal, and how to help the patients to feel comfortable and healthy. So I'd really love to be a doctor. My complete name is Pablo Romero. I've been a doctor for almost now 20 years. I had the privilege to be one of the doctors graduated from this local university, Universidad Autónoma de Baja California, here in Tijuana. So being a doctor for the last 20 years has given me a lot of experience, I think. I had a chance to work in different medical areas, surgical at the beginning of my career, psychiatry for a few years. For the last 8 years, I've been part of this medical team at Hope for Cancer. I'm a physician, general physician for family physician. I had a chance to get a master's degree in regenerative medicine as well as anti-aging medicine, and I had a chance to get another master's in psychiatry. I'm not a psychiatry doctor, but I get involved in the psychiatric field, so it's given me a lot of experience there. It's not a single way, it has different options to follow. It's not easy, and I mean it that I cannot repeat the same pathway or the same formula. Each patient is completely different. Even if they share the same diagnosis or even similar medical situations, it's a completely different way to be treated. So I really like it. Actually, I was taking a break from my medical practice in the psychiatric hospital, and one of my good friends who also work at Hope for Cancer, he invited me to be there and be part of the team. And if I like it, and if I approve the test, being part of the medical team at Hope for Cancer. And I made it. It's been 8 years now. It's really fascinating trying to get in touch with this kind of patients, trying to know what they feel, some of the situations that they live, traumatic events emotionally, and of course physically. But it's really fascinating the way that I can combine the state of mind and of course the physical situations that the patient is dealing. So it's really, I really like it. Being able to work in alternative medicine, it really gives us more tools to deal with the disease or with the situation from the patient. Working in a conventional way, of course, that's the way that we were trained, and any doctor needs to be trained that way, but it doesn't give us the chance to really be more open in general to another alternatives, another way to heal, to provide a real medical solution to the situation. And sometimes I think if you keep working in a conventional way, you're not really allowed yourself to get or to know different things. It can be done in combination. Of course, I'm not against conventional medicine, but having the chance of being able to combine the conventional medicine with the alternative way, it provides or gives us more tools to share with the patient and of course finding the natural way to heal the patient. At Hope for Cancer, we really had the chance to provide the patient more hope, a real hope. It's not just the conventional way, but provided the state of mind, provided and explained to them, because some of the patients, they don't really have the chance to explain detail of what's going on. They know that they're dealing with something specifically, cancer, yes, but it's not just a tumor, it's not just the cancer, how it involves different parts of the body, how of course it's going to affecting physically, emotionally, the rest of the family that sometimes they don't know how to handle that. So we really had the chance to work on all of that. It's not just the physical part. It's not easy to deal with cancer. Cancer, it's totally unpredictable. So even if you follow the conventional way, the answer is not going to be always the same. Even if you just keep the alternative way, the same situation. So it's really challenging, but in a good way. Try to find out, try to do more research, more new supplements, new medications, it's not repeating the same thing for all the patients. But in a good way, in a good way, it really challenges you to be better every day. I've been married for 12 years. I got handsome boy Axel and our beautiful baby Mildred. My wife's name is Wendy, and we know each other in the same building that we used to share, of course, a different apartment at the time, but we know each other there. We were neighbors. We had the chance to do a little exercise or physical exercise like any of us needed, playing soccer with my son. And every weekend, or at least twice a month, we really try to do an activity out of the city. Living here in Tijuana has the benefit of you get the beach, you get mountains, you get rivers. So there's a lot of activities that you can do out of the city, and we love that, and our kids really love that kind of activity, and we enjoy that. Reading as well, practicing chess. Our son is coming to be a state competitor, so we like those kind of activities at home. I think I would like to be a rock star, but I'm getting old for that, so no, just kidding. No, I think, no.